I'm not aware that you've always been a somatic psychotherapist, but you had an experience yourself where you went to a session and you personally experienced a rather quick recovery in a certain area. Do you want to talk to us about that?
Yes. One of really the formative experiences I had in my personal therapy really came pretty soon after I started. I had the fortune of connecting with one of my initial therapists, and about 2 months after working with her, I had an experience where I was lying on the mat, and I was talking about some childhood experiences, and suddenly my whole body felt as if I was opening up this huge door. I didn't really know what had happened. The initial feelings that came up were an incredible amount of anger, and I felt it, and I also felt it leaving me. And you know, in successive sessions, some memories did come back, and I worked on them, and what it had told me had happened to me in my life, and very, very deeply, and I grew a lot. I had a level of peace and a level of sort of comfort with my body and myself that I hadn't had in my whole life. And it was simply because I had spent some time breathing and touching into my connection with my body, and it just happened. My therapist was there to be a cheerleader and tell me to keep breathing. It was simply the quality of being with her and her witnessing me heal myself. Some people do get back memories. There's a lot of talk in the field these days about repressed memories.
Right.
Repressed memory is simply a memory that has been buried in the body that comes out as a result of a person's mind connecting with a certain place in their body that unlocks this memory.
So I just want to make this clear. You're saying buried in the body.
Yes.
Not necessarily in the mind.
Yes. Not in the brain necessarily at all. A lot of people who have this idea about therapy, that it's all talking, and I can't talk for an hour every week, I hear a lot. I say, well, I'm not as interested in your life story right now as I am in what you're feeling in your body right now. And if you have things to tell me later, sure, I'm interested in anything that you feel you need to tell me. But really, I'm hearing your whole story in your body as I look at you right now. And the important part is for you to feel what your story is and how what has happened to you in your childhood and your adulthood, however old you are, how that's affected how you're acting and feeling right now. Because that's really the only important thing.